This lecture is entitled The Next Plague, and this was the title of the cover of Scientific American, last edition, The Next Deadly Plague. And it's caused by the fifth kingdom, which is the fungal kingdom. And it was presented Scientific American as a repeat of my article 40 years ago, also on valley fever, a mold infection. And the main threshold of Scientific American was valley fever. Here's Stachybotrys, is the so-called black mold. I will read my article of 40 years ago and compare it to the new one at the end. People still have not clued in that the fungal kingdom is here to stay and is a problem. These guys are a problem. Here's Stachybotrys, a major problem. So, Scientific American, the next deadly plague. Please pay attention. Here's my article from 40 years ago. Anonymous illness caused by mold. Valley fever, including the dog had it too. And we will talk about someone who died from it in the article. So here goes my discussion. Okay, today's lecture is about mold. And I've been studying and treating mold problems for the past 40 years, over 40 years. And I wanted to compare an article that we wrote approximately 25 years ago with an article yesterday in the Scientific American calling mold the next pandemic, basically, the next major infection. And it describes, amongst other things, the main story is on valley fever, coccidioidomycosis, which is a fungal infection, usually starts in the lungs and then eventually can invade the brain and can be fatal, but also can lead to recovery. And what I'd like to do is read the article I was in from the Signal, Santa Clarita, February 18th, 1999. Okay, and it says, I won't say the person's name, but it says the Stevenson Ranch thought he had pneumonia, but after 2 weeks, doctors finally diagnosed him with valley fever, an airborne fungus that attacks the lungs and can lead to meningitis. And the title of the article is Anonymous Illness, and it also says Exposing Valley Fever. So doctors say valley fever, an airborne fungal infection that attacks the lungs, afflicts thousands of people, but most never know that they have it. Though its symptoms mimic a cold, the disease can be fatal. And again, this mirrors Scientific American, June 2021. Okay, Stevenson Ranch resident Tom, I won't say his last name, had never heard of valley fever when he went to Henry Mayo Newhall Memorial Hospital in December. It was just like I had pneumonia symptoms, coughing, really bad cold, hacking, shortness of breath, and high fever, and just feeling basically like a cold, the patient said. After nearly 2 weeks of testing, the patient, age 37, was diagnosed with valley fever, a fungus that grows in the spaces of soil in dry, alkaline, and regions, with cases being sent into the air when the dust is disturbed. Okay, the patient said doctors were able to detect the disease only after extensive blood tests. I had all the symptoms of pneumonia as far as mass in my lungs on x-rays, and I wasn't responding to the normal pneumonia medications. So they had to go in and start taking more blood and finding out exactly what was wrong, he said. The disease, medically termed coccidiomycosis, had been termed San Joaquin Valley fever because of its frequency in the Central California Valley, according to a report issued by doctors Richard M. Dover and Haas Einstein of the Kern Medical Center in Bakersfield. They write that the disease flourishes during favorable weather conditions and is spread once kicked up by the wind or other disturbing force. After the spores are inhaled and go to the lungs, they grow in the tissue, and the pneumonia will spread until the body develops immunity to the fungus and thereby contains and suppresses the infection, or until a medication effective in destroying the fungus or in retarding the growth of the fungus is given, the report said. Okay, and I think it's important here to note, and we'll go into more detail at the end of this lecture, that things have changed in some ways. In all the ways described above are the same currently, but there is a major problem going on that I would like to describe at the end, so please stay tuned. Okay, fever continued. This patient was not the only member of his household to come down with the disease. Shortly after returning home from the hospital, Zach, his miniature dachshund, some may say, or dachshund, was diagnosed with valley fever. I was in the hospital for 2 weeks, and when I came back, my daughter had noticed a lump in the dog's lymph node, he said. The disease is not believed to be communicable, but is common among dogs and other animals. Dogs are especially susceptible because they are close to the ground, and so to continue, dogs are especially susceptible, probably because they are close to the ground and like to sniff in rodent burrows, said Dr. Marian Wydell of the Valley Fever Center for Excellence in the University of Arizona. Zoe's veterinarian, Dr. John Bertelmeyer, said valley fever is not anything new in the area, and he did not recall encountering any cases since after the Northridge earthquake. So that's interesting. After the quake, there were kind of a flare-up. We saw it then from all the dust that was shaken up from the earthquake, he said. Brockenmeyer said most of the cases he had heard of were in areas that were not well developed as Stevenson Ranch, but that some of the development in the area may have led to the contraction of the disease. They have been moving a lot of dirt around and over the Stevenson Ranch area, he said. The Acute Communicable Disease Council unit of the Los Angeles County Department of Health Services reported the rise of 26 new cases in 1998 in Los Angeles County were in the San Fernando and Antelope Valley districts. following a year in which 13 out of 40 were from that area. The city of Santa Clarita lies in both districts, so it would be covered by both. Dr. Gary Ordog, yours truly, a toxicologist from Henry Mayo Newhall Memorial Hospital, said many people have the disease and do not even know it. Ordog, yours truly, said that he probably diagnosed 30 cases over the past 5 years, a number he believes is low in relationship to the number in the Santa Clarita Valley. There are probably a lot more cases that are actually acting or disguised as the flu. The only way to get it is through a blood test to diagnose it. If we do not do a blood test, then we do not know what the actual cause of the fever is and assume it's the influenza, a cold, sinus infection, early pneumonia, pneumonitis, bronchitis, etc. Ordog said, as in yours truly, that we do not usually do the blood tests because it is so common. And most physicians may either not know to do the tests or forget to do the tests. He estimated that 2/3 of the population have had it and just fought it off, thought they had the flu or some form of milder infection, adding that they probably did not even bother to see a doctor. Meningitis is inflammation of the membranes of the brain and spinal cord, and is among the potential diseases that can result from valley fever, also known as coccidiomycosis, a fungal infection. But Ordog, yours truly, said he has known the disease to be fatal only when a patient has immune suppression, when the immune system is already weakened by a disease such as AIDS or cancer. Dr. Ellsworth Pryor, also of Newhall since 1979, said that most of the people infected stays in the lungs and they get pneumonia. He said he has seen between 50 and 100 cases over the years, and in the vast majority of people it goes away and they never even knew they had it, even when they had a skin test, or except for when they had a skin test, or unless they had a skin test, which he says does not always diagnose the problem because it may have not developed yet. So it does take several to 4 weeks to turn positive on the skin testing. And remember, the skin testing is taking a bit of the antigen of the mold, injecting it into the skin. And if you've had a reaction with a previous infection, developed antibodies, then your skin test will develop a red and sometimes swollen area, which can be used to help diagnose that you've had coccidiomycosis or valley fever previously because you developed antibodies. So if you're still sick from it, then you get tested. The test is positive and the doctor feels you have valley fever, then they can make the diagnosis based on the association with the blood test. Wow, I don't know if you can see the cottonwood coming down, but wow, it's like snowing here. Getting covered with it. Okay. So the patient who we were talking about with the dog Patient and his dog, the one who was really sick, was treated and given antifungal agents. Who recently quit smoking, said that the habit may have placed him at more risk of developing the fungal infection, such as valley fever, which is what he had. Okay, I've had pneumonia before. To my lungs are really susceptible, and that kind of just, and I smoke, and it really comes to you because of smoking, he said. No one's ever told me to quit smoking. Okay, if you smoke, your lungs are going to be 100%, but I had pneumonia before and I didn't think my respiratory system is full force anyway. So some interesting comments. Perhaps he thought he was more susceptible to valley fever infection and pneumonia because he was a smoker, and the smoke had somehow damaged his lungs and made him more susceptible, decreasing his immune response and allowing the fungus to start growing inside his lungs. Again, the infection does not cause pneumonia in most people. They just think they have a cold or flu. But in his case, he smoked. He ended up being hospitalized and almost dying from pneumonia. So he required antifungal agents under diagnosis and treatment. To combat the disease, this patient is taking 800 milligrams daily of the medication diflucan, which kills the coccidioides fungus while it is in the lungs. The patient said his dog is also taking a smaller dose of diflucan, 3 milliliters per day. Notice the units are different. My strength is coming back slowly, he said. Everything I've read about valley fever is that it's a slow fever and it's not a bounce-back process. Valley fever is nothing new to Santa Clarita resident David Hamilton. Hamilton's father, an entomologist, died from the disease in 1969. Hamilton said his father, Warren, who used to work for the Department of Agriculture, first started displaying symptoms of the disease after being transferred to Twin Lakes, Idaho in 1957. He said the doctors were not able to diagnose his father right away because the landscape there does not fit the bill of being dry and hot, so it may not have been even entered into their minds. In Idaho, they simply do not recognize these symptoms for what they were. Valley fever is not going to be high on the list in the northern area. Hamilton said his father's problems began with an infection in the right ankle joint, and long before he had to have his right leg amputated. After being diagnosed in Idaho, Hamilton's father was sent by the government to the public health office in San Francisco, where he would stay months at a time. The fungus traveled through his bloodstream to other parts of his body, he said. They took x-rays of his joints and they were essentially gone. They were just all chewed up. Warren Hamilton, who died in 1969, was moved to a rest home when it became apparent the disease was going to be terminal. Hamilton said that his father's condition, which included the amputation of the left arm above the elbow, coupled with limited knowledge about the disease, led to drastic measures by health officials. A few days before his death, the rest home where he was basically got ordered to throw him out because at that point he had such severe infection They couldn't handle it there, Hamilton said. Some health officials ordered his coffin to be sealed because they were so concerned about the infections, he added. The Santa Clarita Valley falls under the jurisdiction of the South Coast Air Quality Management District, which has two particular rules for addressing dust abatement. Rule 402. Has anyone from putting contaminants or other materials into the air which cause injury, detriment, nuisance, or annoyance to any considerable number of persons in the public, or whether endanger the comfort, repose, health, or safety of any such persons or the public, or which cause or have a natural tendency to cause injury or damage to the business or property. However, according to the rule, those growing crops or raising livestock are exempt from punishment for the odors emanating from such practices. Rule 403 goes into greater detail regarding fugitive dust and is chiefly concerned with the prevention of dust from man-made sources from emanating to other areas, listing various sources of fugitive dust and actions that may be taken to control it. That was 40 years ago, and I do note that things have changed markedly in the meantime, especially in the treatment. As you noted, the diflucan worked against the fungus in those days, but today all of the antifungal agents are basically useless because they have been dumped on agriculture and the fields and used in many other different places, impregnated into building materials, etc. So I used to use itraconazole or Sporanox that used to work for valley fever, but apparently no longer today. There are new generations of antifungal agents being produced. So that's a significant change in the last 40 years, and I hope no one listening to this contracts the disease. Thank you. End of dictation.